people don't really ask the question. They see you kind of doing the work with families. They see you working with young people that are going through kind of chaotic and stressful situations and moments. But we don't really look at, the impact that it's having on the people that are doing this type of work. It's difficult. We're talking about working with, families, talking about working with parents that experience their children being locked up, their houses being raided, getting a phone call that their child's in hospital due to a stab or gunshot wound, or sometimes dead. And working in the community or working with families and individuals that are experiencing that trauma has a significant effect, oftentimes on us as the professionals. And it's something that we don't really talk about. And I think mental health is important. And I think it's something that we as professionals should be talking about. One of the things that I kind of go through, and I think a lot of people kind of echo that, is it's hard to explain. It's like a numbness. I'll give you a scenario. So, the rise of kind of the violence in the West Midlands at the minute, a lot of kind of myself and colleagues have been working quite intimately with a lot of these families and parents that have been affected by the violence, whether families of the perpetrator or victim of the incidents that we've been hearing about. And I remember speaking to a father, and he called me and said, this is what the scenario is and this is what the situation is. He started crying. And it's interesting because as kind of professionals, and you think of how we're kind of trained and the knowledge and expertise that we kind of develop through our training, we are kind of taught to kind of detach ourselves from those emotions and detach ourselves from people. But when you hear a father crying from his soul, and you hear a mother looking at you like, what do I do now? Or you hear a young person say, you know what? Because my friend just got shot and my friend was innocent and he's dead, and now I want to respond a certain type of way. It's trauma being transferred. And I guess any human being, before you're a professional, any human being that is exposed to that level of trauma consistently is bound to have a detrimental impact on your own mental well-being and the way that you think, the way that you feel. So that's why I go back to the concept of the numbness. And in many cases, I feel numb. And then that would indicate that we as the professionals have also become traumatized. And those multiple traumas that we experience through our everyday lives and our experiences and working and talking about and trying to console and be around individuals and kind of give hope whilst we're having the smiles on our faces, it's important to talk about that numbness. And then it means that we need to think about ways in which we can kind of, engage with that. It's hard. It's a hard question, and I think it's a hard answer, and I don't think there's one shoe that fits all. So I only can talk about me. I guess I got to a point in most recent times where I felt like I had to just take some time out, start kind of questioning yourself, what, am I built for this type of work? Should I be doing this work? But then I genuinely feel that I look around and there's not many people doing what we do. So you have to be an individual that sacrifices in some aspect to your people, your community, but at the same time trying to keep your own sanity. And it sounds strange, but those that work on the front line get what I'm talking about. So like, for example, me taking time out might mean that, I detach myself away, I go away, go and have a nice weekend away and do whatever. But then if your phone rings and it's a family member that you've worked with and known, or someone that's quite personal to you and says someone's been shot and they're dead, you could be in a time of having a rest, but you have to go straight back in, because the work that we do is not 9 to 5. It's 24/7. It's non-stop. And with the environments in which we're living in, it feels like it's non-stop. So there's things that I can do of, as I said, I can go away. I've got excellent mentors that I talk to about my thoughts, my feelings. I train, I go to the gym, I try and keep myself as fit as possible to kind of take my mind off those things. If I have the opportunity to go on holiday, I'll go on holiday, but that's something that I can't do frequent because I'm working all the time. and also practicing being still. And I think, enjoying your own space, your own time, not necessarily having to always be around people. But also the last thing, and it's funny because I talk about this quite a lot, and also my friends and having good people around you. So I'm a part of like a WhatsApp group, and it's a lot of my friends, and a lot of them don't do the work that I do, but they're just comedians, and they're always laughing and joking and saying something just stupid, but it's hilarious. And the reason why I value that is because when you have people that whether it's friends, colleagues, relationships with individuals that are in this type of field, every day they tell you about some sort of traumatic experience. And I have to tell people now, stop telling me about the madness. I don't want to know about who's got shot. I don't want to know who's got stabbed. I don't know who's got beat up, etc., etc. So this group, sometimes it's just good to just detach from the world and just listen to the jokes, because that's what kind of keeps me going. Talk about it. I think we don't talk enough. That's the problem. We talk about the problem. We help to deal with the problem, but we don't talk about ourselves enough. I went to an amazing lecture the other day, and the lady's title was "It's okay not to be okay," and I've kind of been running with that since I've left. It's okay not to be okay, and I think don't be afraid to tell people that you need help and support. Don't be afraid to tell people I'm struggling. Don't be afraid to tell people, listen, I don't want to hear about it no more. Don't be afraid of doing that. Don't see it as a weakness, see it as a strength, because you're showing people that you're human. You're showing people that you're not a robot. You're showing people that, I'm an individual that has thoughts and feelings and emotions just like you. And I think that we as professionals need to kind of start thinking about ourselves, because the reality is if we're not okay, then the environment and the young people that we're trying to support and the families that are going to support are also not going to be okay. So we need to try and get a balance where we're okay. So I'll finally just say it's okay not to be okay.